Medical professionals, what's the craziest DIY treatment you've seen a patient attempt? I had a guy come in for coughing and shortness of breath for the past few months. His lungs sounded like absolute crap. Got a chest x-ray that looked horrible, so I did a CT scan. Radiologist called it the worst case of necrotizing pneumonia he'd ever seen. The guy had like a 15% functional lung tissue left. The patient then mentioned things had been worse after he started using a new breath freshener spray. He whipped out one of those blunt effects concentrated air freshener bottles supposed to cover up green herb smell. Labeled not for internal use. Apparently he'd been using it like Banaka spray and had already gone through 3 bottles. Paramedic here once had to explain to a family that putting lemon juice in the eyes of an unconscious patient isn't an approved treatment method. And no, it didn't work. It was an interesting moment when I had to explain why his eyes hurt, though. Smelling salts, same logic applied for seeing acids. Anesthesiologist here, we had a patient come in for I&D of bilateral deltoid abscesses. He apparently had thoughts of being a bodybuilder, but instead of lifting weights or knowing someone who could hook him up with some quality roids, he decided to bulk up using some protein powder at GNC, and mixing it with water, drawing it into a syringe, and injecting the 20 to 40 cc's directly into the muscle. If bulk was what he was going for, it definitely worked, temporarily. A rip-roaring localized infection makes you look pretty swole. They also got almost a liter of pus mixed with liquefied protein powder out of each deltoid. This also wasn't the first time he had been in for this problem. That last line kills me. Try it once, shame on you. Try it more than once, what the frick are you doing with your life? My dad had an abscess on his face. It was huge, about the size of a golf ball and horribly red. It kept getting bigger. My mum, a nurse, kept telling him to go to the doctor, but my dad was a ridiculous cheapskate. One day when she was gone, we noticed a big whitehead had formed on the abscess, and it was apparently ready to pop. My dad went out to the garage, got his shop vac, placed it over the whitehead, and proceeded to suck out the abscess. It worked surprisingly well and healed up after that nicely. Mum was still furious, though. It's a pity these medical stories tend to do quite well on the channel, because these are also the ones that leave the narrator dry heaving over the side of his recording setup. This was the first one of the day to do so, although the next one admittedly took me even further. If I've learned anything from reading the stories here, it's that some people, particularly men, will tolerate almost any amount of pain to avoid a doctor seeing whatever stupid crap they've done to themselves. This is no exception. I once spoke to a paramedic who went out to a man at 2 a.m. who had excruciating pain down below. The poor organ was wrapped tightly in soaking bandages, and underneath was a blackened member with large pus-filled holes in it. The man eventually admitted that he'd shoved a chicken bone, a clean one, whatever that means, down his pee-pee hole for pleasure. Predictably enough, he couldn't get it out, and being too embarrassed to go to the doctor, he had left it until he was in so much pain he couldn't walk, both from the rotted eggplant and the fact that he hadn't been able to urinate for days. Apparently, you couldn't actually see the bone once the wound was clean, and although not an expert, my friend couldn't imagine that what was left was salvageable. In nursing school, while I was on clinical rotation in urology, there was a man who ended up having his member removed. It turned out he had an infection brewing for quite a while and thought the best course of action was placing a sock over it in the hope that it would heal. He was generally confused and upset as to why this didn't work to heal the issue. One of my first clinic patients was a guy who was injecting a mixture of testosterone, human growth hormone, sesame oil, and sunflower oil into the base of his member as a DIY enlargement therapy. Well, it got infected, so he ended up going to the ED for incision and drainage. I saw him as a post-ED visit, and at the time, he figured that he shouldn't be injecting things into his eggplant while it was healing, so instead he was injecting his oil and sketchy hormones off the internet concoction everywhere else into his body. Arms, legs, butt, shoulders, etc., because he figured it would still have some effect. Judging by the rest of these stories, some men are capable of committing atrocious, heinous acts of terror on their own members. There's a myth that lowering someone's core temperature will save them from an opiate overdose. As a result, many first responders have arrived on scenes to find friends or fellow users inserting ice into someone's butt. Sometimes they don't have ice though, which leads to people getting pretty inventive. Popsicles, frozen hot dogs, my personal favorite, which regrettably I didn't witness myself, it was told to me by another medic, was a bag of frozen French fries. Cold will do nothing to help someone who is overdosing on smack or other opiates. What they need is respiratory support, oxygen or artificial ventilation, and naloxone, Narcan. If you're a user or know one and somebody ODs, call 911, perform mouth-to-mouth and give Narcan if you have it, but leave the popsicles in the freezer. I work in dental and years ago had a patient attempt to superglue her front teeth back on after they broke in half. She screwed up and ended up gluing the chunk to her upper lip. I had a dental patient with a dead front tooth that had turned black, so she painted it with white nail polish daily. This happened when I was still a med student doing a rotation in the ED. The patient comes in and is pretty vague about his actual complaint, something about head pain, but he looks just fine sitting, waiting to be seen. When I finally get to see him and ask what actually happened, he removes the hat he was wearing and a chunk of skin about the size of my hand literally flaps off his skull. This man managed to basically scalp himself and apparently it had been like that for 3 days. According to him, it was caused by falling in his bathroom and hitting his head on the toilet. He had been previously duct taping it down or using the hat to hold the skin on, but it wasn't sticking well and that's when his wife convinced him to come to the hospital. Pharmacist here, worked in a shop where a woman asked for some advice about a potential UTI or STI. Told me she had bathed her hoo-ha in bleach for 5 minutes to try and kill any bacteria. Miraculously, she hadn't done any lasting damage. An old lady told me the rain hurt her arthritis. That's reasonable. She also swore that dog spit had healing properties, so she let her dogs lick her feet when she felt it coming on. She then wanted to show me a video of said dogs licking said feet. I swiftly and politely declined. Adult patient had gas and poked a hole in his belly button with basically a knitting needle to release it. It didn't work. He actually came in for the ensuing infection in his belly button. Oh God. I don't know what age I was before I came to the conclusion that poking holes in my body's organs was a bad idea, but it was at least a decade earlier in my life than this gentleman. The young narrator was a moron, so what does it make this man? I work in oncology pharmacy. I had a patient die of totally treatable chest cancer because they decided to treat it with mistletoe instead of chemo, all because Suzanne Summers did. Yeah, the Thigh Master Lady. Don't take medical advice from the Thigh Master Lady. The most heartbreaking thing I've seen is a desperate husband bring his wife in at death's door. They were young with 2 kids under 10. She had been diagnosed with breast cancer and didn't like what her oncologist was telling her. To be fair, that crap is terrifying. She then left the UK, so all of the chemo and surgery that was free at the point of access, and followed the alternative practices recommended by some witch doctor in her own country. By the time her husband dragged her back, she was too far gone. Had spread to too many organs, trouble with breathing, groggy, seizures from brain mets. I work in ED. I don't know how oncologists and palliative care teams do what they do. Of all the horrible traumas I've dealt with, this is one of the most upsetting cases I've ever picked up. A little late to this thread, but I have a weird one. A patient was told by her doc that she had low magnesium and should consider supplements. Not uncommon. Instead of getting MG supplements, she ate an entire tub of homeopathic volcanic ash and completely destroyed her electrolyte imbalance and ended up in ICU. We admitted her as a pharmaceutical overdose, so poison control automatically follows up with you. It was hard to explain to them. It was probably naturopathic, not homeopathic. I don't know enough about specific differences. Think of a tub of protein powder, but volcanic ash. Her husband brought it in for the poison control report. You were supposed to mix in a scoop with water for the health benefits. She ate the whole tub and had a seizure and wrecked her kidneys. The activated charcoal and volcanic ash vomit that was all over her when she came from emergency was a B word to clean up. A mentally delayed woman came in septic to the ED. We did x-rays, blood cultures, urine cultures, the works. Finally found this weird image on her pelvis film, and we had the gyn come in to do a pelvic exam. They pulled out this blob with bones in it. Y'all, I swear to God, it was a decomposing frog. She put it in her hoo-ha for safekeeping. She got toxic shock syndrome from a frog. Ribbited for her pleasure. My boss is a nurse practitioner. I asked her what the worst thing she had witnessed was. She continued on to tell the story of a man who had stapled his ball bag together onto his body after slipping with the razor. He had had it that way for days, metal holding his poor testes in place, infected and gross as you'd expect, before he came in to a professional. Later admitted his ex had attempted to castrate him. The organs lived, never fear. You can submit your own stories to be featured here on the channel. The story submission link is in the description below. And if you want to listen to some vibey music in the background, check out easymode, also linked below, and subscribe. A guy came into the ED because his leg was swollen. I'm talking like twice the size of his other leg. It turned out that his 4th and 5th toes were getting caught on his sock, which to be fair sounds kind of annoying. So he cut them the frick off with scissors. And then, surprise, it got infected. And he waited, and that's how he lost his entire fricking leg. Had a young teenager with sickle cell disease who had been in the hospital for around a week, already who decided to manage his pain himself. This was a few years ago, but I caught him pretending to take his meds. He would cock his head back and gesture that the pill went into his mouth, but really he either kept it in his hand or he threw the pill behind his back and landed somewhere in his bed. He was also quite a talker, which I then assumed was a tactic to try and distract me. I kept seeing his odd behavior and caught him doing this 2 to 3 times by the middle of the shift, so I was definitely onto him. He had a PICC line, which is essentially a long IV where the tubing goes all the way to your heart, in his left arm. And I noticed it was quite a bit more swollen compared to his other arm. Sometimes clots can happen in PICC lines, so that was my biggest concern at first. But the line was drawing blood fine, so I knew it wasn't clotted off. I told the doc, then I drew blood from his PICC line and sent it down to the lab to be cultured to see if there was any bacteria. Lo and behold, it came back positive for bacteria that's commonly found in tap water, and usually not a source of infection in the infected PICC lines. Fast forward a few hours later, he confessed that with any oral medication, pill form, he can slip by the nurses, he saved for later in order to crush it up himself to try to dissolve it with sink water in the bathroom. Every room had a private bathroom, so he could inject it in himself via his PICC line. Having once seen a commercial that oatmeal can lower cholesterol, a patient started having chest pains and tried to resolve it with a bowl of oatmeal. We had a guy come in with an abscess on his right thumb. When I asked him what happened to his hand, he told me about his recent deep-sea fishing trip and was given the responsibility of cutting the fish with an open wound in his hand. A sliver of fish got in there and became infected as it healed, so this guy gets the bright idea of doing a little DIY wound drainage by grabbing his pocket knife and cutting it open again, leading to greater infection. Yep, I also had a smack addict cut her thumb on her broken smack pipe. The thumb was incredibly infected. She grew tired of waiting for the hand surgeon to arrive. She was in the operating room with another patient, so she bit her finger to release the pus. Then she left the hospital, cursing the staff the whole time because we're useless, etc. As a child, I got really bad sunburn. The person looking after me coated my sunburn in baby oil to help it heal and sent me back out into the sun. I realized when I was older why my mum went nuts. I have a Jamie Oliver recipe that directs me to do the same thing midway through roasting a chicken. My mater would have literally murdered if someone did that to one of her kids. Crackling, crispy skin in 30 minutes. My mom once melted Vicks VapoRub into my tea because she thought that would help my cold. It didn't help my cold. I know people who would do this, more than one of them. They swear by Vicks VapoRub and kinda treat it like a cure-all. My neighbor came over to borrow a chainsaw. I noticed he had a thick bandage around his arm and asked him what happened. He said he fell out of a tree last week and cut his arm. I asked if he got stitches and he said he just wrapped it up and his family was praying over it. About 4 days later, I saw his wife, and she said he was really sick and may have the flu. Came to find out he had septicemia and was dying. He died a week later of kidney failure and sepsis. Putting an adult fun toy up the butt to better reach another, larger toy. Patient used to get hard-ons in class and it embarrassed him so much that he used rubber bands to prevent it. Ended up killing the tissue in his eggplant and now he needs a catheter for life. A man who'd accidentally sliced his leg open at his workplace. He obviously figured that as surgeons use staples to close wounds, he'd cut out the trip to the hospital and DIY it, with an ordinary desk stapler. Arrived in ED with a pus-filled wound with the odd discolored staple hanging off it some days later. I am not a medical professional, but my father-in-law had severe skin cancer. He basically had an open sore on his back for several years that bled and bled. We never knew about it until one day we saw a pancake-sized crater through his shirt. Went to the hospital finally, and they basically said he had cancer through his entire body at this point. His response was that he thought it was a cut that wouldn't heal and put gauze and neosporin on it. Since folks are curious, yes, he is still alive, but they didn't give him much time left. They managed to treat the wound, but the cancer spread into his organs and bones. The sad part is it could have been avoided if he just went to a doctor years prior. But that is unfortunately the common mindset in a lot of older folks. White bread soaked in milk placed on an armpit abscess to draw out the infection. They needed an IND and a couple of weeks of IV antibiotics by the time they got to us. Either that or the guy who crashed his motorbike, scraped his leg all to heck, and then decided the best course of action was to self-cauterize it on the tailpipe. Wow, stupid or not, the tailpipe guy had a set of brass ones on him. When I worked in the ER, my colleague had to see a guy with an ear problem. He had something stuck in his ear and had been trying to get it out. This wasn't a new thing, he had been trying for some time. Turns out he'd completely removed his tympanic membrane, and the bits that were stuck in his ear and that he was trying to pick out with cotton buds and hair clips were his ossicles. Enjoy! Had a patient come into the ER with a makeshift bandage on his shin. He'd fallen on rocks while hiking and had left a 3-inch long, half-inch deep gash in his leg. I go to pull the bandage off, and as I'm peeling it away, I notice the skin is completely black, and there's dark chunks of fungus falling out of the wound. It looked necrotic, like it had been left alone for a week. I look at this guy like he's crazy as he tells me the wound is only a few hours old. He's pretty proud as he explains that he created a makeshift poultice by chewing up leaves and moss, mixing it with river mud, and stuffing it into his leg. That's what all the black mossy stuff was. Hint: don't do this. My grandpa thought a leg discrepancy was causing my back pain, which was causing spasms. He put several pieces of cardboard in my shoes to try and even out my legs, which were already even. He also thinks black beans cure everything. My dad thought those pesky spasms were a pinched nerve, so he'd take me to the chiropractor, his girlfriend, to get my neck cracked whenever it happened. Seizures, people. They were seizures. My stepfather thought he had a boil of some sort on his arm a few years ago. So he did what any middle-aged dad would do, cut the sucker open and poured hydrogen peroxide on it. Turns out it wasn't a boil but a form of skin cancer. Also turns out that hydrogen peroxide doesn't do much to help with melanoma. After a lot of one-sided discourse, he went to the doctor to get it checked and treated. He's now cancer-free. Good God, how is this man one of the most sensible people in this entire grouping? I'll take this as an absolute win over the many, many men in the earlier stories who no longer have usable reproductive organs. When I was an internal medicine resident, I came across a very nice 50-year-old Dominican lady. She was very well-mannered, but one could tell she was not the sharpest tool in the shed. As I was prepping her chart for our first visit, I noticed she'd been seen by every single digestive disease MD in our hospital system. Not only that, she had had every single procedure in the book, ranging from endoscopies up both holes and culminating in an exploratory laparotomy. You're opened up to basically look inside you when we have no clue what's going on. All of this because for years she'd had one single complaint. She reported severe gnawing pain in her stomach. At this point I should mention she was Spanish-speaking only. Not only that, she had a very heavy Dominican accent, and I was the first Hispanic doctor to ever see her. My first language is Spanish, and even I had difficulty understanding her. So she comes in, and after exchanging some first-time pleasantries, I politely ask her how she's doing. Sure enough, although she was smiling and said she felt well, she pointed at her belly and said it was biting again, and asked for cream to kill it. At this point, I got intrigued. Her medication list only mentioned a cream used for herpes breakthroughs. The previous fellow only mentioned in his note that in every single visit, she only asked for the cream and nothing else. When I asked her what she meant by the biting and what she intended to do with the cream, she very calmly tells me she intended to stick the cream up her butt in order to kill the bird living inside her. After delving more deeply into her story, it turns out she didn't have a medical condition. Ever since she was a little girl, she believed that after eating a whole quail egg, the bird had spawned inside her and gnawed away in her insides whenever she was hungry. After a short visit to psych, she was diagnosed with a somatic-type delusional disorder. No amount of medication or psychotherapy will cure her, but she was still a fully functional mother of two who paid her taxes and had part-time jobs. I reached out to every digestive disease doctor in our hospital system once more to make sure she never receives an inappropriate invasive intervention. I've been following her for 3 years now, and she's happy as one can be, considering she has a bird living inside of her. When you subscribe, make sure to hit the bell to turn on notifications. Put the playlist on in the background to finish listening to all the stories, or if you want some vibey music to put on in the background, check out easymode. If you like Am I the Genius, give Am I the Jerk a shot. Everything linked in the description.